My name is Shane Smith. I'm a general dentist, and there are 5 common questions about root canals. It doesn't. When having a root canal done, you're numb. You shouldn't feel anything, just like any other procedure. We don't want to go into a tooth, with a nerve, with the patient feeling it. Our number one is just to make sure you're comfortable. It should just feel like we're having generic dental work done. It's just feel like, okay, there's just water being sprayed and vibration, things like that. But you shouldn't have any pain through a root canal procedure. The objective of the root canal is pretty much replacing the nerve with a material that helps seal it, prevent infection. Most of the time when people need a root canal, that nerve is already dead. It's just a bunch of bacteria inside it. It's something that needs to come out. Even in cases where there is still a live nerve, it's to the point where it will continue to an infection. So removing that is the better option versus letting things go bad. Everything is typically set and ready to go. You can eat on the tooth. Sometimes you got to be careful with the tooth if it hasn't had a crown yet. Say you had a root canal and a molar. Soft foods for a little bit. Just be gentle with the tooth. Let it heal. It's going to feel kind of like it's bruised afterwards. So just like with anything else, just let it heal. Give it time. A root canal does not cause cancer. I think a big part of that thought process or the problem is if there is a failing root canal, if there is bacteria being leaked into the body, that response by the immune system itself can just eventually lead to issues. So it's always good to just keep on your recalls, keep on appointments so that things can be caught. And that's part of why we do take importance over like 3D x-rays, because we want to make sure any existing root canals are still performing like they should. We don't want any infection lingering. If there is still a problem afterwards, we want to be able to manage it, take care of it. We don't want anything like that to happen. We want to make sure root canal is successful and that the patient doesn't have to worry about anything like that. It's always good to keep the tooth when you can. The tooth kind of does support the jawbone. It supports your facial structures essentially. If you have a tooth removed, the bone does start to shrink. You start to lose that chewing function, and eventually you can lose the opportunity to replace it with like an implant. Being able to do a root canal to save the tooth is conserving more tissue than just the tooth itself. So it's holding that space, it's allowing you to function still, and removing that tooth. You can never go back to a natural tooth.